Hey everybody, we are live. We are coming on. It's the 3rd of July, almost the 4th. We are here daily, or actually weekly, sorry. But we're here for our usual tip Mondays. Here, I'm Dr. Joel Pasquale, physical therapist.
My name is Dom Gomez, also physical therapist.
Personal trainer Peter Tapau.
And today we're going to talk about actually massage tools. We want to show you some things that you might have at home, see if you guys use them, and teach you if you don't. But before we get into that, I wanted to, recently I had a patient message me some bad news, He said, I just want to get you guys' opinion on what his statement was. He's like, he can't exercise anymore because he now has arthritis.
Interesting.
Do you hear that?
Yeah, I hear that a lot. What do you think, Dom, about
Yeah,
that?
I definitely hear that a lot as well. So arthritis is a natural kind of phenomenon that everybody's gonna have, and really it's characterized by stiffness. And I always tell people, I tell people a lot that motion is lotion when it comes to arthritis, and I get complaints in terms of when I sit for too long and then when I get back up and start moving, it hurts initially, and when I move more, it actually feels better.
Yeah.
So it's kind of the opposite of you have arthritis and now you're not going to move or exercise.
See, but the doctor says, look, they see the X-ray. They're like, you have arthritis. That's the reason for your pain.
Yeah. What do you think?
Well, there's a lot of things that comes to that. I mean, there's different levels of arthritis, right? You've got the very severe versus the very minimal. So I think it's always good to kind of correlate that information with their doctor to kind of see what limitations or movement patterns they can go by. I mean, this is where the scope of practice comes into play. But I think as prescribed, I think in terms of like just overall movement, could definitely motion is lotion. But at the same time, I also feel I've also run into some patients who have very extreme arthritis, like what's that? What's the other?
So there's another level with
Yeah.
the more systemic. Are you talking about more like rheumatoid arthritis?
Rheumatoid.
Yeah, and that's more of a systemic.
Yeah.
That is in a way similar but different because you're getting that more systemically versus the natural occurrence of arthritis.
Sure.
But yeah, there's definitely varying degrees of arthritis for sure. But always just taking the image with a grain of salt.
Exactly.
I think a fresh baby's like bones, no arthritis, right?
Yeah.
I think of that as like the brand new Michael Jordan shoe that's like fully clean. And then then when you start wearing it, putting it on, once you put it on the floor and once you walk out on the asphalt, you're gonna start getting marks on it.
Sure. Yeah.
As much as you would not want to have marks on that, you're gonna get marks on it, and that's kind of the marks that you see on the image, that tread.
Yeah, and given that too, just because our imaging nowadays are really really sensitive and really good that you almost see everything, and you can't really. Pain is such a complicated phenomenon that you can't really specifically with 100% certainty that you're saying, okay, you have arthritis and then now you have pain. If you have arthritis in one part of your body, most likely you have arthritis in somewhere else, and that part's not having pain. So how would you explain that? Pain.
Yeah, yeah. I want to talk with you about that even deeper, about like with like images with like disc herniations, right? You've seen studies
Yeah.
with people who have never any history of back pain. They've got images done to them, and then they got findings that would be considered significant findings, but yet they don't have any history of any back pain at all.
Right. Right.
So what do you think is a solution for all of this, in your opinion? Because you guys are in, that
The
field.
motion. The motion is the solution. I mean, just like what you said. I mean, I think of when I'm driving to LA, I am sore and stiff when I'm driving my knees. If I get out of the car, initially it's sore and stiff, but then once I start moving again, right? You talk about the motion and its lotion,
Right.
then the pain goes away.
I think that the key piece is the education on and pain, and you need to take pain in context, right? Because pain in general, or as a sole thing that you're gonna base your
Assessment,
in
Yeah.
is not a good source of, you know, you got to take it into context. So for example, a paper cut, right? It hurts a lot initially, but it's a paper cut. Versus, let's say somebody's a carpenter and they accidentally cut their finger off and they don't have any pain initially.
Yeah.
But that's like, okay, we need to take you to the hospital.
The
kind of
adrenaline
thing.
is so high.
Right.
Yeah.
Right.
See, you would think that person that chopped off their finger would have a excruciating amount of pain. They can, but not always.
So what are you saying, Dom? You're saying like with people with arthritis, as if they're a patient to you, you kind of take in their information, and you're saying like, you know, you prescribe something based off of that, or are you saying that sometimes some of that could be in their minds? What are you trying to say with that?
Definitely take it into context, and definitely pain can be affected by the mind, but it's also, again, pain is so complicated that your threshold for pain can go up and down based on your mental state, right? Your stress level, your sleep, your general nutrition, a lot of different things. And again, taking pain into context and not just a sole factor to, you know, to your decision making is important.
Be holistic,
Be holistic. So how would you handle it if because I have a client who has these issues, and she feels like she can't move, but I tell her like doing daily small movement patterns would help her get the confidence, because I think in her mind it's like, I'm so much in pain, I can't move, I don't want to do anything, I want to stay where I am, but that's not improving anything because it's almost going to atrophy, right?
Right.
So I guess in a way for me, and what I'm trying to say is that, you know, it's about how you handle that communication with the patient. I think when you talk to your patient, you got to get to know where they are, what they're all about, and see what's kind of like doable for them. Because the one thing you don't want to do, and although you may know that's the right thing to do, is force them into something that they can't do, or they don't want to do, or they can't do, mentally and physically. Because, you know, again, some patients are very kind of like dogmatic about how they feel, that it's almost like, that's how I feel, and I'm gonna stay with that.
Right.
And then we know as professionals like, oh no, you got to do this and this, but we don't want to overstep that and say like, your feeling is not valid. We kind of want to gonna go where you are, meet you halfway, and help you get there.
It's back and forth, because I mean, we're always going to doubt ourselves. So it's being able to have you're encouraging that person to trust the process, and it goes both ways. You knowing their family situation too, you could prescribe a certain workout. You could change it based on how they're feeling that day. So
it's definitely a lot of patient education for a lot of these kind of pain cases or
long
arthritis.
time pain. It definitely does. It definitely messes with, it smudges your kind of the wiring of your brain. So it's calming those nerves down, desensitizing.
Desensitizing. I think that's good that you guys talk about that, because for one, I think a lot of doctors or professionals that deal with patients, and especially when we're talking about like the outpatients in like major hospitals, they kind of look at you and be like, okay, here's a paper and that's it. And they don't kind of give you that detailed thing, you know what I mean? And I think that's what separates us from them, is because we want to kind of know you, right? And then kind of like give you more of a better holistic prescription versus, you know, I don't know if you guys ever been to like a hospital, you get this piece of paper and that's your exercise, you know what I mean? Or they see you once or twice, physical therapists, right? Because you guys some people have so much a load, or they have so much volume of people coming in, it's hard.
Yeah, well, that's why we're out of the clinic too, where we could spend more time and really focus on the patients. So versus having them count as like a number and quickly be like, here you go, just follow the cookie cutter approach.
We call these PT mills, or
They just
can churn, So,
but if you guys are catching this on, if you guys are still on, go ahead and type live if you're on here live, and let us know if you're catching us on the replay. Type replay. We want to know who's coming on here. Thank you for supporting us. But let's get into the some of the muscle relief stuff. So we were talking about like joint stuff with arthritis, but now with these massage kind of tools to help us, that's kind of more for our muscles.
Yeah.
To give us relief. I'm gonna just go in and just grab this one here. This is one of my favorites.
Oh, that's one of my favorites too.
I could just have this next to my chair all the time, and
It's a,
it's a
looks like a
little
weapon.
knob here. Yeah, you could use it for spanking. But yeah, just putting it on these knots here on the shoulder, really applying pressure. Where I see a lot of people make the mistake is they might just massage, so just moving it around. But we want to just sustain pressure and hold.
and there's a name for that, right? What do you call that?
Like an acupressure release.
Yeah, or trigger point there,
point
trigger
release,
point
yeah.
there. Yeah.
So it's finding that knot with this knob, finding it, placing it right on top of it, pushing down, use these handles to push and hold. So this is a bigger loop too here where you can go around. See, so it's just very universal, just dig anywhere.
Yeah.
And also these knobs over here, you can also do with a little bit of hip flexor. You can press it into here.
Right.
You can even get into some shoulder. And that's a great thing about these knobs, is that they have different like levels to it, or features, if you will. And they do have some of this as well in like Walmart and Target.
Yep.
But this is the original one. It's called
Terracane.
Terracane. So
Yeah, because I think those other ones that they have at the stores, like this is very flimsy.
yeah.
It could break easy. This is like
Solid.
the Cadillac.
Yeah, the Cadillac, the original.
Right.
You can use the arcade a little bit, walking. Is there anything else here that you like to use?
You want to get something dumb? Or?
Sure. I am kind of interested in what I've seen one of these, but I've never really. I don't know what the purpose. Do you guys know what the purpose of this?
Yeah, it's for your head.
It's for
Yeah.
I can see that.
It's more, I guess, in the scope of like, we're talking about certain tools that help muscle release. This is more like stress relief.
Oh, interesting.
Yeah. So this touches on places, like it gets into touches on the sensory parts of your
Yeah, I mean, just think about it.
forehead.
How
and
often
your
do
head.
you actually really like touch your head?
Yeah.
The desensitization.
And just this feels good actually.
I think honestly it probably makes you smarter because it will activate. It will wake up some of those muscles in the brain. And
Yeah. It stimulates you. There you go. Stimulation.
I
Muscles
think it
in the
worked
brain.
for me.
Yeah.
So
Like-
some difference.
Yeah, this is good. This is good in terms of that. It's really it's good in terms of like just more like stress relief.
Because there's these muscles right here, the temporalis muscle here too.
Yeah.
A lot of people get
Right,
tension
right.
here. If you're biting your jaw, you're really activating these muscles here. So that's going to cover and hit those muscles here, the temporalis muscle. So if you suffer tension headaches, that could be a good option to try.
That's a good one. That's a good one.
But also watch your posture too, and that's something that we won't cover right now.
Right.
Another cool one, massage gun.
yeah,
You guys see this a lot? So every store mostly has this, Walmart, Target, Amazon, and they have different kind of guns, but basically what you do is it has this vibrating effect, which helps relieve a lot of pressure on certain muscle areas. And what you want to try to do is like touch on those points like you would have in your body. Like for me, it's like my traps and my shoulders. And just it's kind of like using the vibration of the tool to kind of help relieve some of that pressure.
Especially if you're really sore.
Yeah, especially some really sore. And this is good too. I mean, like you can do it to yourself, or you can have someone to do it. Which I think is better, because by having someone doing it to you, you're you're more relaxed and it's getting the right spots. Yeah, it just feels a lot better.
So Dom, you're an Olympic lifter.
Uh-huh.
So what do you think about using that as a warm up to prime your muscles to be able to lift or work out?
Yeah, I mean, definitely with the tactile kind of cue there. If you're thinking, okay, I want to activate my glutes a little bit more, you could definitely try to use that with that.
Are you seeing people using that at the competitions, like beforehand?
No, not well. Beforehand, mainly for trying to relax the muscles and warm up the muscles, and not really.
Because the thing is, like, what setting would you need to put it on? Because, like, I see the benefit for tactile to kind of prime the muscle.
Right.
But at the same time, is it relaxing it?
Exactly.
Versus if you're relaxing it, it's not going to be beneficial to actually lift right after.
Right. Depends. Right. I definitely see more people using it as a relaxing tool versus like an activation.
Yeah. Okay.
I didn't even know that you can activate that.
Yeah,
That's
I mean,
pretty
I
cool.
think it's just kind of the physical therapist kind of way of thinking of, you know, yeah, I guess the normal people won't know that. So,
Right, right.
yeah, like if we're in the clinic and we're, you know, sometimes I'll try to tap on the area. What's a common one? Like the glutes is a common area where they're not firing as ideal. So we'll use a tapping kind of cue to like have them push and activate and wake up those muscles.
And you can do that with the massage.
I can
tool.
see how you could do it. Yeah,
Yeah,
I
yeah,
use a
yeah.
lot of my hands. So
Yeah, me too. Especially, let's say you had a total knee replacement and the quad muscles almost go on vacation.
Yeah.
And then trying to do quad sets and just tapping and saying, "Hey, this is what I want you to activate." Is essentially.
see, the benefit with the hand though is actually you could actually feel them engaging that muscle versus if you're using a tool, it could help, but then you don't for sure know like how well are they activating that muscle.
You can't tell the depth of it. Yeah, that's a good one. I like that. Okay, that's something new. I didn't recognize.
But what about the ball?
Oh yeah, that's another one. Want to talk about this?
Oh yeah. Again, with the trigger point stuff, I like using this to just kind of dig in. I even like doing like a pin and stretch where, can you hold this for a second,
Yeah.
Joel? Where I'm pinning and then stretching that muscle at the same time. So pinning and stretching, you get a little bit more.
It's
of
more of a dynamic stretch.
Right. Yeah.
Right. So here, and I'm doing this specifically because I do weightlifting, right? So this is to improve your overhead position in the snatch.
But overall function too.
Yeah.
Yeah.
I like this a lot.
Yeah. And they all come in different sizes, by the way, too.
I mean, you can put this on, you know, people with their painful feet, if they've been on their feet all day, plantar fasciitis type symptoms. Just throw this down and just roll your foot right on it.
I like it.
I mean, even just to use as a ball, like, to throw around. Multifunctional. But yeah, the thing is it is hard to get it up here in your shoulder. I think more in the back is really beneficial.
ideal.
Like laying on the floor or laying on the wall while you're leaning into that ball, that's going to help.
Yeah.
So.
We'll show a lot of stuff there too. So guys, thank you guys so much for checking us in. I hope that you got educated about arthritis, what are the protocols and pain, some massage tools. That's like 2 subjects we did talk about. Again, we're all about helping people. That's the reason why these guys are not working in the clinic, or they're not in, not the clinic, but the hospitals, right? Because you want to be more of those personal doctors and
Holistic
physicians.
and know them inside and out
Inside
where
and
you
out.
get better recommendations.
Exactly.
So.
Yeah.
So
So
I just want to run back we're not trying to say no pain, no gain, right? I just want to make that clear.
Okay.
Just take pain into context. Yes, pain is real, but you just got to take it into context and don't be too scared of pain.
yeah.
Yeah.
Good. So I hope you guys can reach out to us. Actually, reach out to us. Let us know what you're feeling, and if you guys want something more personal, all 3 of us have our DMs there available for you. So just go ahead
Just
and
reach out to us.
Yeah,
Yep.
and then we're here to help. That's it.
Thanks, guys. Happy 4th.